If you're a woman with a uterus, you probably should learn about uterine fibroids, which are tumors that grow in the wall of the uterus, and they are mostly always benign, which means they do not pose a risk for cancer. And fibroids can vary in size from being small as a little seed to as large as a watermelon. And sometimes they can grow in clusters, which means you will have multiple tumors within an area, or it could just be the single tumor. And usually, fibroids will develop during a woman's childbearing years, with the highest prevalence happening in women in their 40s and 50s. And they are pretty less common in women under 20 or women after menopause. And so it's important to note that many women with fibroids will show no symptoms, but others will show, very visible physical symptoms such as heavy and very painful periods. They will have pelvic pain or pressure in your lower pelvic area or in your lower abdominal area. You'll also experience frequent urination and sometimes pain during sexual intercourse. And so it's important to also note that there are certain risk factors such as ethnicity and race and obesity, which could also impact a woman's ability or predispose a woman to get fibroids. So, as earlier mentioned, again, as you get older, women in their 30s, 40s, 50s are twice as likely to get fibroids. African American women are three times as likely to develop uterine fibroids as compared to women of other races. And it's not really clear this racial disparity. That studies are not really shown why there is this racial disparity, but women, African American women, really have a higher chance of developing fibroids. Another thing could be family history. If you come from a family where women have been diagnosed with fibroids before, then you get about a three times likelihood of getting diagnosed with fibroids as well. And another contributing factor could be things like obesity. If you have a high body mass index, you could get fibroids, and this is linked to the fact that women that tend to be obese tend to have higher estrogens, and that is really one of the most scientific causes of fibroids. It's really higher hormonal production, which could be estrogen. And also, women that got their menstrual period early. So, if you got your menstrual period before the ages of 12 and 13, you are at higher risk of developing a fibroid. And people that have vitamin D deficiencies. So, if you live in cold areas where you don't have access to the sun as much and you don't supplement with vitamin D, you could also be at risk of developing fibroid. And so, if you suspect you have a fibroid, these are some of the things that you should be looking at that could make you start questioning if you have a fibroid. And this could be, again, heavy, long, painful periods, right? If you have these periods that are pretty painful, they last 7+ days and they're pretty heavy, that could be a telltale sign that you may have periods. And if you also have bleeding in between your periods, so in between your menstrual cycle, you're having periodic bleeding, that could also be a telltale sign. If you urinate constantly, if you have pain in your lower abdominal area or in your lower back area, if you have pain during sexual intercourse, or if you always feel full or your abdomen is large and distended, that could be a sign of a fibroid. So if you suspect this, the first thing to do obviously is to get a confirmation with your gynecologist. It's important to go talk to your gynecologist and get a confirmation that you do have a fibroid. And based off of that diagnosis, you would then come to a treatment plan with your healthcare team. Certain treatment plans could involve a surgical, which is a surgical procedure called a myomectomy. So this is essentially surgery where the fibroid is removed, but they preserve your uterus. So that's always an option. There are also medications that could be taken that would not require you getting fibroids, and mostly you would go the medication route if your fibroids are asymptomatic. So you want to discuss again with your gynecologist or with your healthcare provider on what the options should be. And you also want to discuss the impact of your fibroids on your fertility. If you're somebody that's still looking to have kids, fibroids can sometimes interfere with fertility or increase the risk of pregnancy complications. So you need to be able to start discussing this early on with your gynecologist if you are still of childbearing age and want to be able to give birth to kids.